inviting Dr. Sangeet Mittal to present his Narsing Award paper, Homemade Do-It-Yourself Aqueous Sampling Device for NTA Chamber Tap in Endophthalmitis.
So good afternoon, everyone. So
it is very interesting to see his videos. No.
Good afternoon, everyone. I'll be presenting on a homemade do-it-yourself aqueous sampling device for anterior chamber tap in endophthalmitis. So endophthalmitis could be post-operative, could be post-traumatic, endogenous or secondary to keratitis, and a rapid diagnosis and appropriate treatment is required to save the eyes from irreversible blindness. So accurate, appropriate, and adequate sampling is the key to precise microbiological diagnosis. So the various specimens that we can have are vitreous tap, vitreous biopsy, or vitrectomy fluid, which is more sensitive, but it has to be performed in operation theatre, and a retina specialist is needed to do that. So considerable time is lost before initiating the treatment, leading to further growth of organism inside the eye and cause worsening of condition. So aqueous tap can be done by a comprehensive ophthalmologist and can be done before referring the patient to a retina specialist. The purpose of this study was to compare the aqueous tap performed by novel aqueous sampling device with conventional sampling method using 26 gauge needle mounted on a tuberculin syringe, and to compare the sensitivity results of aqueous sampling device with vitreous biopsy. It was a randomized controlled clinical trial. So this is how traditionally the sample is taken. You introduce on a tuberculin syringe, you mount a 26 gauge needle, and then you insert that needle into the aqueous chamber and withdraw the aqueous fluid. But the problem is that the eye need to be, if you are doing it under topical anesthesia, the eye need to be held by an assistant, and there's a lot of cumbersome doing it. So we devised a new method. This was a 2 cc syringe which was cut, the flanges were cut, and it was a rubber suction cup was attached to the top of the syringe. The 26 gauge needle was mounted on the syringe, and this is a demo you see. When you press the bulb and you release the bulb, the fluid collects into the syringe. This is the live demo of the same procedure. You insert the needle after pressing the bulb, and then you slowly release the bulb, and you can get an adequate sample into the syringe, as was obtained in this patient. So there was 40 clinical diagnosed cases of endophthalmitis which were divided in two groups. Group A, conventional technique using 26 gauge needle with on a tuberculin syringe, and group 2 was this novel device, using this novel device. And all samples were collected by ophthalmologists in operation theatre under peribulbar anesthesia. Aqueous tap was done, followed by vitreous biopsy and injection of intravitreal vancomycin and ceftazidime. After collection, samples were sent to laboratory for immediate inoculation and gram stain. So positive result means organism detected on either gram stain or KOH stain or culture. Results were also compared with vitreous biopsy to rule out any false positives. So the groups were evenly matched, and we got a significant difference. Like in the positive result, we got only in 3 patients with the conventional technique, whereas in the 9 patients we had a positive result. And when we matched it with the vitreous biopsy, the difference between the positive result of the vitreous biopsy and the result with the conventional technique was much higher, as compared to the aqueous sampling device. So the aqueous sampling device was found to be more accurate, more sensitive, but the specificity was the same as with the conventional technique. So adequate sample was obtained. There was no need of an assistant. Sample can be obtained by comprehensive ophthalmologist. Sample can be taken without delay at a primary center. Positivity is comparable to vitreous biopsy, and this whole instrument can be prepared immediately or can be pre-prepared and sterilized for a later use. The limitations were that it was a small sample size and it was not a blind study. So though vitreous is the best source for obtaining a specimen for culture or smear examination, the aqueous sampling device is easy to use, and an aqueous sample is obtained using it before giving an intravitreal antibiotic by primary ophthalmologist. It gives adequate positive results, thus avoiding delay in treatment and worsening